Hi everyone, this is Mr. Neil Reiter, consultant audiologist and director of ClearWax. Thank you for joining me in another demonstration video of our recently developed WAXscope, which we're hoping to launch very imminently. We shall be hopefully sending an email out to our mailing list with some dates in the next week or so. Fingers crossed. In the meanwhile, this patient attended with bilateral occluding dry dead keratin balls and dead skin that was just lining the ear canal and had failed to migrate. I actually performed the procedure in their left ear first, but for the purposes of the video, I've decided to show you their right ear first. And I'm just commencing with microsuction. I'm using our 4.25mm speculum here. We've got 4 speculum sizes to choose from, the smallest being 3.5mm and the largest being 5.75. For this particular patient, the 4.25 was just about right. The wax and dry skin, it's really quite hard and solid. So in a moment, I'm going to use an ear hook. When you've got a wax of this consistency, it can be difficult to suction because you just don't get that suction grip. So I'm just bringing it forward. You can see that first bend there just to the left. And I'm just dilating and straightening the ear canal. They did have quite a bendy ear canal. I'm just gliding in with the St. Bart's ear hook to the roof superiorly. I then rotated the hook 90 degrees, so the tip of the hook embeds itself into the core of this really dry keratin wax plug and then slowly extracting it. It actually got trapped at the entrance, so as I mentioned, they've got quite a bendy ear canal. So as we were extracting it, it just got lodged at the entrance and just re-entering with the ear hook. And again, I'm just stretching open that first bend. That reflection is very common when you remove dead skin. So dead skin, the keratin in the skin is very reflective. It's also good at reflecting dangerous UV rays from the sun. It's one of the benefits of having keratin. So keratin is a protein in our skin cells because it does provide both a hydrophobic protective layer and also a UV barrier, but it can also be quite reflective when you've got the light shining. I could have just reduced the exposure, but it wasn't really affecting me, so I just continued. And I've just reverted back to the Zollner suction probe. I'm just trying to wriggle this through, so it's quite a large piece. You can see it's just coming past the first bend there to the left. You always know the first bend because you get the hairs protruding out and extending out from the first bend. So again, just some residual keratin that had broken itself off from the main plug and ball, and there's just some keratin lining the posterior canal wall here, so I'm just going to peel this away, and in a moment we're going to examine the ear. So as I say, quite a bendy ear. You can see that second bend just to the right there, and I'm just going to rotate the speculum now to straighten the ear canal. You can see a nice healthy eardrum, good light reflex. So that's their right ear completed. This is their left ear. So I just adjusted the focus. You may have just noticed a difference in focus, and it's so easily done with the WAXscope. When I previously performed microsuction or earwax removal, should I say, using head loops or an ENT microscope, which I just still sometimes occasionally use, just to keep making sure my skill levels are still there. I think it's important, just in case I ever need to revert to the microscope for a reason. It'd be good just to ensure that my skills are always refreshed and up to date. But one of the things I suspect, if you're doing it all the time, it's not much of a bugbear, but you keep losing focus just with a little of movement from the patient. So I then have to adjust. So sometimes I'm moving my head forwards and backwards. But with the WAXscope, once the WAXscope is in situ, you don't really have to move your head to adjust the focus. You just simple swipe of the focus bar on the monitor. So just in this ear, as well as the ear hook, I've also used a Jobson horn because the consistency of this is a bit softer. You may have noticed the difference. So in this ear, there's also dead keratin skin, but also a lot of earwax as well. So Having saying that, the majority of earwax is made up of dead skin cells, around 60%, but I would say in their right ear is probably a higher concentration, probably 80%. And so again, just gently trying to scoop this out, but it's got attached at the bottom. So what I've done there is rotated the Jobson horn, and I'm just trying to, you can see that skin that's attached to it, and that's also attached to the canal walls. I'm just trying to separate that skin from the floor of the ear canal. So the purpose wasn't actually to remove the wax, and it came out brilliant, but I was wanted to just detach it there. And then I'm going to go back in to see if I can just release it and bring it forwards now. So I'm just with the hook at the front part of the ear canal here, the bottom. You've got to be careful not to embed the Jobson horn too deep into the keratin and wax, because you run the risk then of grazing the floor of the ear canal. You're less likely to cause trauma with the Jobson horn, but if you're using an ear hook because of the sharp tip, well, I say it's sharp, but it is blunted, it is rounded, but nonetheless, if you embed that against the canal wall and you scrape along as you extract the ear hook, it will cut into the canal, so you have to be really careful. So now that I've loosened and detached this skin and wax, I'm just going back in with a microsuction probe, and slowly but surely just extracting it from the ear. So those hairs, they are from the first bend, and where I am now, that's the second bend. So the first and second bend are probably about half a centimetre, between half a centimetre and a centimetre apart. And that region of the ear canal is the narrowest region, we call that the isthmus. And then there is also a second narrowing deeper in the ear, towards the eardrum, about half a centimetre away. And that's the second isthmus within the ear canal. So just some residual wax, that's a bit deeper on the posterior canal wall. So we're just going to get it in focus, and we're going to gently remove that. So it's a sensitive part of the ear, so we're quite deep, so just some skin there that's in the way. So we're going to be really gentle here, just lifting it away. Now, if I wasn't able to remove that, it wouldn't have been a problem, would have left that. It's non-significant, it wasn't affecting the patient. But if we are able to safely, why not? This is more, that piece of wax there and skin was probably mid-canal, wasn't as deep. You can see there's some dead skin there. Patient does suffer from psoriasis, so no doubt that's also contributing to the build-up of dead skin within their ear canal. And it's just some keratin at the front. I just want to see if I can peel that away. So I'm going to stretch the ear canal. I'm going to straighten it in a moment, just to visualise. So that's the posterior aspect of the TM. So just change the focus. I just want to peel some of this away if I can. Got to be careful, don't make contact with the canal wall itself, because it's we're on the bony part of the ear canal. Actually, this is the cartilage portion. Now we're entering the bony part, just here. You can already tell the difference between the bony part of the ear canal and the cartilage portion of the ear canal. The bony part of the ear canal just seems a bit more shinier and glossier, and that's because the skin is extremely thin on the bony part of the ear canal, less than 0.1 millimeters in thickness, whereas the skin on the lines the cartilage portion, the outer third, is a lot thicker. It's about 1 millimeter in thickness, and that thickness of the skin that lines the cartilage and the bony part of the ear canal gives it a slightly different appearance. It just seems more fleshy on the cartilage portion and a bit more shiny and glossy and delicate on the bony part. So I've just stretched and straightened the ear canal. You can see the whole eardrum there. Really pleased with that. And in a moment, you're going to see a still image of all the wax and keratin that are removed. You can see we used almost a full array of instrumentation. The hook, the Jobson horn at the bottom left, which is at an angle, so you don't see the hollow scoop, and the microsuction probe at 9 o'clock. Well, I hope you enjoyed that video, and if you are interested in the WAXscope, please do feel free to email info@clearwax.co.uk. Thank you.